Again, thank you so much for joining us here on Idaho Today. 30% of adults in America are considered obese, and obesity is often associated with conditions including high blood pressure, high cholesterol, and sleep apnea. But St. Alphonsus can help with their bariatric program. I sat down and I spoke to Dr. Daniel Pryor to learn more. Dr. Pryor, weight loss can be a challenge for some people, and I hear statistically that 30% of adults here in our country are considered obese. So what are their options with St. Al's when it comes to weight loss, especially with the bariatric program?
Yeah, so we have a comprehensive bariatric program that really starts patients on the journey to surgery, gets them through the surgery, and then continues to follow them afterwards to hopefully help them be successful long term. This is like I said, comprehensive program, so that includes things like dietitians, many visits with us, mental health screenings. Typically we'll run people through a couple of different tests along the way and make sure that they're really ready to go through this kind of a journey. Okay,
yeah, because like you said, it's a journey, right? So it's not just about the surgery. You had mentioned mental health, you mentioned post-support. So there's a lot that goes into this program.
Absolutely.
Yeah, okay. So who's an ideal candidate for something like this?
Typically, we still run by insurance requirements for bariatric surgery, and that includes a BMI, body mass index, of at least 40 or 35 if they have a medical problem that is associated with obesity. Things like sleep apnea, things like diabetes, they may lower that BMI requirement so that people can be eligible for surgery.
Got it. Okay. So let's talk then too about the benefits of this type of surgery.
I love my job.
That's good.
And that doesn't answer your question, but the reason I love my job is because I get to see people go through a really big life-changing event for the better. Most people who have bariatric surgery lose between 50 and 75% of their excess weight by about 2 years after surgery.
Oh, wow.
And through that, sometimes my patients will come into my office and tell me that they are able to go to the park and run with their kids again. They can feel more comfortable getting onto an airplane. They have so many different life experiences that most of us don't even think about that is different for them, and it dramatically changes their life. Some people are able to get off their insulin medications. Some people have resolution of their high blood pressure. So the effects are huge for people, and that's why I love my job.
And so it's a whole new lease on life.
Absolutely.
A whole new way of living,
yes.
a way that possibly they never really even knew was possible for them, right? So as far as the bariatric surgery, let's talk about that process. How long is the procedure? What does the recovery look like?
Depending on the surgery that you have, it can take between 1 hour and about 2.5 hours.
Okay.
Most people stay one night in the hospital and go home the next day. Most people take about 1 to 2 weeks off from work, and most people do quite well from a pain standpoint, a nausea standpoint, and get back to their lives pretty quickly. Wow,
okay. So most, like you said, can actually return to work in 2 weeks?
Absolutely.
My goodness.
Yes.
Okay. That's a lot shorter than I had, for some reason, envisioned this process going. Okay. But like you had mentioned, though, there's also support afterwards that's provided because this is a program, right? It's not just a procedure. This is a program.
Absolutely. So we follow our patients very closely after surgery. So we will see them many times in the first 3 months, and then we continue to follow them every 3 months until they hit a year, and then every year we'll continue to see them back. We want to make sure that they are on the pathway for success.
Okay, so we're talking about bariatric program at St. Alphonsus, but we cannot talk about the topic of weight loss without addressing this, because this has been a big buzz in media, socially, people using type 2 diabetes medication for weight loss. So is there actually a place for this when it comes to weight loss?
Absolutely. This is a really interesting and new and controversial topic. So you'll hear different names for these medications. The most popular would be semaglutide, Wegovy, and Ozempic. Those are the three names that you'll often hear through media. And they are really effective medications for the right person. We are starting to see integration of that in both non-surgical pathways and in surgical pathways for helping people to be successful. But as with any new medication used for a new indication, it's still the wild, wild west. We're still figuring things out. There are some people who tolerate it really well, some people who have a lot of side effects, some people who have a lot of weight loss with it, some people who don't have a lot of weight loss with it. And so there's a lot of variation, and we're certainly excited about the direction that it's going, and we're certainly really trying to dig into the specifics of who it's best for.
Yes, I like how you put that in a very relatable way. It's still the wild, wild west, right? We're still discovering, so patience in that area. But if you are looking for a program right now and you might qualify, this bariatric program could be the answer that you're looking for. So where can people go to learn more and find out if this is the right solution for them?
Yeah, probably the easiest way to find us would be to search on your browser for St. Alphonsus weight loss or St. Alphonsus bariatrics, or you can go to the St. Alphonsus website and look for bariatrics there.
Wonderful. Dr. Pryor, thank you so much. Greatly appreciate it.
Absolutely. Thank you.